Today is our COVID update, specifically dealing with the Delta variant and where we are both as a country and as a state. The situation is serious and alarming, and we are rapidly approaching critical. Let's start with what we are seeing to the south of us. In each of these waves, what we have seen are places like Florida and Texas and Louisiana. It may start, but it continues to build all throughout the South. We've shown you that Arkansas had only a handful of ICU beds left. Mississippi, the same way. This has now hit Alabama with only 2 ICU beds left. Remember, this is statewide, and we are seeing this in every state to our south. Folks, when the ICU fills up because of COVID, primarily with unvaccinated individuals, it means there is not a bed when someone is in that car accident, has a heart attack, has a stroke. And we are seeing this and starting to see it more and more across Kentucky. Dr. Stack's going to talk about this more, but you just look at Western Kentucky. Jenny Stewart Medical Center has talked about their hospitalizations due to COVID up 500% over the last 2 weeks. Vanderbilt Medical Center, where many people in Western Kentucky have to go when things get serious, is full. Baptist Health Paducah, Baptist Health Madisonville, both warning online that their cases are significantly rising while their resources are rapidly diminishing. Mercy Health reporting a 21% positivity rate. And if we needed to push people over to Bowling Green Medical Center, full ICU, 47 patients hospitalized for COVID-19, 11 on ventilators. That is just one region of our state and shows how concerning this is. This isn't just hitting adults. The U.S. has now reported a record COVID hospitalization number of children. If we could pull that up. What we are seeing is more than 1,900 kids in the United States currently in the hospital for COVID, far more than we had ever expected, more than we have ever seen, and this number continues to grow. Folks, what that means is with the Delta variant, your kids are at a greater risk than they have been. And we continue to see challenges in school systems, especially those school systems that have not required masks or that have gone back and forth. This just hit the Courier Journal, Southern Indiana, 750 students in quarantine. Just haven't been back, I think a week, maybe a little bit more. This is a district that has changed their approach over time, but it's clear. It is clear that unvaccinated, unmasked children are going to end up in quarantine and not be in school, or worse, they end up with COVID, or worse, they end up hospitalized. Those kids and all the adults are masked. Keep them safe, lessen the quarantines, keep them in school.
Good afternoon. From the early days of this pandemic and beyond, we've known masks are one of our greatest weapons against this virus and one of our very best tools to protect ourselves and each other. As our students are heading back into the school rooms, cases are surging, especially among our children, because of the Delta variant. Wearing masks and protecting our kids has never been more important. Following guidance from the CDC and support from leaders in healthcare, business, and education, last week Andy issued an executive order to mandate face coverings in all of Kentucky's K-12 schools. We know this is the right step to protect students and educators alike and to ensure our kids stay in school. Of course, requiring face masks means we must also ensure our kids have access. That's why the Lieutenant Governor and I started Coverings for Kids last August. As our kids returned to the 2020-2021 school year, we wanted to make sure that all of our children were protected. We encouraged donations and to date have received more than 1.8 million masks for our children. One of our greatest donors to the Coverings for Kids initiative was the Ford Motor Company, which donated 1.5 million masks. Ford is an incredible employer and partner here in the Commonwealth, and also supplied 2 million masks to the state's PPE stockpile last September as part of Project Apollo, their ambitious program that brings together top engineers and members of the United Auto Workers with the goal to produce 100 million masks throughout this year. They've made great progress on that goal right here in the Commonwealth. Today, I'm delighted to announce that Ford Motor Company has answered the call once again by donating 1 million more masks for our children. As students head into this new school year, which will undoubtedly be a challenge while we battle the Delta variant, I cannot overstate how important this donation is. Until every child can get vaccinated, masks are our greatest weapon against this virus, a vital tool to keep students and teachers safe and healthy. Ford's donation is helping ensure we can meet our top priorities in battling this pandemic, to keep Kentuckians safe and healthy, to keep our kids in the classroom, and to protect our surging economy. Thanks to Ford Motor Company for this generous donation and for prioritizing our kids. Thanks to you and our other incredible partners, we can defeat this virus once and for all. Just on a personal note, I beg you, parents, please mask your children. You do not want to have that conversation with a child who is sick when they are afraid and they ask if they're going to be okay. Do not want to have that conversation. Please mask your children, get them vaccinated. Thank you.
Thank you to Ford. Thank you to the First Lady and the Lieutenant Governor for their endeavor to make sure every child will have an available mask to ensure that we can keep them as safe as possible. And that need is great. If we look at our stair-stepper chart, the Delta variant continues to burn through our population here in Kentucky with the most severe escalation, meaning the most rapid rise in cases that we have seen to date. Folks, we've lost 7,400 people. So me now saying we are experiencing right now the most rapid rise in cases ought to alarm everybody and get everybody on the same team to do the right thing. Certainly, we are facing, for the unvaccinated, the most dangerous situation to date, and a situation that is getting more dangerous for the vaccinated. Just look at the cases week by week as we look at this escalation. Again, we don't want to see these lines going straight up. That is exponential growth, and every time the line gets steeper, it grows more concerning. This Delta variant, it's no joke. It is out to get, to harm, and ultimately to kill as many people as it can. We need folks to do the right thing to protect themselves and do their patriotic duty to help us beat this virus. That starts with getting vaccinated. That continues with wearing a mask in the situations that you need to. Let's look at our positivity rate. If I'm right, this is the third highest week, this last week, that we've had since the beginning of the pandemic in our positivity rate. And again, look at the rate of increase. That looks pretty exponential. And it's going to be hard for it to continue like that because it is already so high. But this is in that most dangerous zone that we talked about earlier in this pandemic. Let's look at our COVID inpatient census. This and the next two charts are even more concerning than what we have shown. What you see is exponential growth in the number of Kentuckians in the hospital with COVID, meaning really, really sick. Hospitalizations have been doubling every 2 weeks, something we've never seen before. Again, Dr. Stack will talk about it more, but by the end of the week, we expect to have, by the end of this week, we expect to have more Kentuckians in the hospital battling COVID than at any point in this pandemic. Those are your friends, your neighbors, your loved ones, people you fought for all the way up to now. And we need everybody to continue to do the right thing and to realize what this also means is we are very close to all of our hospitals being full. It is something that we may well see here in the Commonwealth. And what'll that mean is it's one facility fully full one week and very, very close the next, while the next one in the region is entirely full. And this means that folks that are in for other reasons have a tough time. I have a family member that had a bad fall and is needed to be hospitalized, and we were very worried about her being able to find a bed. We don't want to see anybody else in that situation. People out there harmed in the line of duty need to have a bed when they are hurt. If you want to preserve that, if you want to support the people around you, if you want to support those that go out and do dangerous jobs, get your vaccine and wear your mask so that they have the help they need if they're hospitalized. Let's look at folks in the ICU. So the intensive care unit is called that because people are in really, really rough shape. When you enter the ICU, you know it's gone to an additional level. And let's not kid ourselves. We have people hospitalized right now that probably need to be in the ICU, but because of the number of beds and the crush, aren't in there. This rate, again, before the end of the week, will surpass the highest that we have ever had in this pandemic. And a certain amount of folks with COVID that go into the ICU aren't coming out. So the more people in the ICU, the more people we will lose. Drive that point home. COVID patients on a ventilator. I don't know how many doctors we need to show intubating someone while they beg to get the vaccine and being told that it is too late. This line is made up of people, made up of a crush of people coming in to the hospital, being sent to the ICU, and then being put on a ventilator. And we see all the stories about them wishing they could get the vaccine. They're not stories, they're real. And then begging their family members that hadn't to get the vaccine from their bedside, again, not knowing if they are going to make it out. So again, we are asking everybody, get this vaccine. And we are seeing an uptick in vaccinations. We crossed over the weekend and coming into this week over 2.4 million Kentuckians being vaccinated. Now 2,425,305. And as always, we look at it both demographically and regionally. Demographically, we're excited to report our total population 18 and up has increased 1 point to 66%, meaning 66% of adults, that's 18 and up. Remember, you can get a vaccine 12 and up, have now gotten at least their first dose. 65 years and up, we're still at 64%. We've been stuck there. This does mean 16% of those that are the most vulnerable against the most dangerous, deadly variant we've ever seen are still at risk. So if you are over 65 and you haven't gotten your shot yet, please get it. If you know of anyone over 65 that hadn't gotten their vaccine yet, please have that uncomfortable conversation. That's where we are. At this point, folks aren't going to believe me. They're not going to believe somebody else in government. They might not believe their doctor. But you, their family member or their friend, saying that you love them and that you care about them and that you're willing to even lose that friendship and that relationship if it means having that hard conversation to get them vaccinated. Folks, I need you to do it, and they need you to do it, even if they don't know it quite yet. 50 to 64, now up to 69%. That is up 1 point. 40 to 49, also up a point. And then 30 to 39, up 2 percentage points. This one moved from red to yellow. Now with the Delta variant, it's probably not yellow anymore. We need a lot more than 51%, but we are seeing movement in 30 to 39-year-olds, which is good because 30 to 39-year-olds are dying at a higher rate than we've ever seen in this pandemic. 2 over the last 4 days in their 30s. I think I talked about them in yesterday's video. I think over the last 3 days, not including today, we lost 25 Kentuckians. 11 of them were under 55 years old. This is making younger people very sick. 18 to 29, we haven't seen a lot of movement, and we really, really do. need to see that movement. 12 to 17, again, we're looking at the new census information that's come out so that we can get a denominator and have a percentage here. Folks, it's under 40 is my belief. Under 40% of those eligible 12 to 17 have gotten that shot. Those are the kids eligible in school to get the vaccine. And when you combine that with those that aren't, remember, I got one child who's old enough to get vaccinated and has been, and Brittany and I have one that's not. And we worry about that, certainly. And that's why we're willing to make the hard decisions on masking and to talk to our kids about it, who don't mind at all. And she doesn't mind as long as his brother has to wear his too. Let's look at geographic. Counties above 50% vaccinated hadn't changed. And we need that too. Remember, the blue counties in here are the only counties in the state where it's more likely than not that the person you're interacting with is vaccinated. Otherwise, it's more likely than not that the person you're interacting with is not vaccinated in every other part of the state. And you even look at counties like Woodford County and Franklin County where they're reaching 70% of everybody vaccinated. And you're still seeing a push on hospitals because the Delta variant is so serious that even that 30% is a lot of people that it can harm. And as we'll talk about, we're seeing more breakthrough cases, and we believe that we will continue to. Counties that have moved over the 40% threshold, again, this isn't anywhere close to enough, but Livingston and Morgan, thank you for your work. Please continue to push. And so in this one, with the Delta variant, if you are not in the blue, that means more than 6 out of 10 folks that you're going to come in contact with haven't been vaccinated at the deadliest time during this pandemic. And you know, folks, we've lost a lot of people that didn't have the option to get vaccinated or fully vaccinated and would trade just about anything to be in a spot of somebody right now that for whatever reason hasn't done it. So today, we're joined again by Zonetown Fire Chief Kevin Moulton, who joins us again after being with us at the Capitol March 6th of this year on that 1 year anniversary of our first case of COVID. At that time, he shared the story of two of his own who were taken by this deadly virus. Chief Rob Orkes, a beloved community leader who gave a lifetime of service, and Major Gary Key, an inspiring man who dedicated 36 years of his life to Zoneton. Now we're going to hear more from Kevin, who wants to talk about the importance of these vaccines and how I know he wishes and those families wish to have had that opportunity to be fully vaccinated. Kevin.
Good afternoon. As the governor said, my name is Kevin Moulton with Zoneton Fire. I had the opportunity and the honor in March to be invited here to honor the two great men, Chief Rob Orkes and Major Gary Key. The reason we honored them was because they were two great fathers, husbands, grandfathers, friends, bosses, mentors, and heroes that lost their lives too early to COVID-19. If you ever had the honor to meet these men and hear their stories that they had to tell or work beside them in the many roles that they played, you were lucky. Governor, again, thank you for allowing me to speak about these two great men. I'm glad to be the voice of these men when I say, please get vaccinated. I know that they were waiting to be vaccinated, waiting for the vaccine, and waited to be fully vaccinated. But unfortunately, the vaccine was just a few months too late. If vaccinated, life could be different. Wives would have husbands, kids would have fathers, grandkids would have grandfathers, and the fire department family would still have mentors and leaders. Looking at our medical runs that we have made in the last month, they have dramatically increased because of the new Delta variant and the illness that the variant is bringing with it. As many have said, this variant is affecting our little ones and the younger people more than the earlier COVID-19 strain. Please help us as first responders protect our families and those that we protect daily, and protect your loved ones as countless first responders lose lives on a daily basis due to this pandemic. We need your help now. Please get vaccinated. Thank you for your time.
Thank you, Chief. You can tell that's tough for the Chief, who's a big, tough guy to talk about. But he's doing it because he doesn't want others to have to go through what those two families have and what he and his brothers and sisters have gone through. Please, everybody, it's not a game, and it's too late. It's too late often to get somebody vaccinated. Those that you love, I really need you to reach out to and try to encourage them. Try to be patient. But at the same time, I hope you can be firm about how much you care about them and about how strongly you feel on them getting vaccinated. We're going to hear from, via video, a couple of others who are encouraging the same. The first is from Lake Cumberland Regional Hospital. This is their top medical staff, those that have been taking care of this region forever, those that are trusted in so many different ways. And they're giving voice to what we all need to hear, and that's that the vaccines are safe and effective.
We've done so much already to protect ourselves and each other from COVID-19.
Every vaccination brings us closer to a future free of COVID-19.
The good news is that the FDA-authorized COVID-19 vaccines are highly effective at preventing infection.
The vaccine does not contain the live COVID-19 virus, and it is not possible to contract COVID-19 from being vaccinated.
Vaccines have undergone extensive and rigorous testing prior to FDA authorization.
Vaccine side effects are mostly mild but may include pain or soreness at the injection site, fatigue, and headache.
Your health means everything. Get vaccinated today.
I'm Dr. Tanya Shea.
I'm Dr. Joe Weigel.
I'm Christy Purcell.
Dr. Barry Dixon.
Courtney Troxel.
I'm Dr. Patrick Jenkins.
I am.
And I am.
And I am
A vaccine hero.
If you're in that Lake Cumberland region, remember, these folks aren't the governor. They're not somebody sitting in Frankfurt. They're your neighbors. They're the people that you may have taken your kid to if they broke an arm or a leg. They're the folks that maybe took care of your parents at a different point. Please trust them. Trust them now as they're trying to look out after you. Next, we have the head of Bourbon Community Hospital and Life Point, Central Kentucky, giving us two messages. Number one, hospitals are filling up. And number two, we need you to get vaccinated.
Hello, my name is William Haug, the CEO of Georgetown Community Hospital here in Georgetown, Kentucky. I'm also the market president for Life Point Central Kentucky, which is comprised of Bluegrass Community Hospital, Bourbon Community Hospital, Clark Regional Medical Center, and Georgetown Community Hospital. Our community hospitals play a vital role in the health and well-being of our local communities. Today, I want to share what we are experiencing in our hospitals and encourage all of you to please get vaccinated. We are seeing an increase in COVID-19 patients across our hospitals as the Delta variant continues to spread. We are taking additional safety precautions at our facilities, including strict masking rules, social distancing, and limits on visitors. We take these precautions to keep our staff and patients safe. We need to band together to protect our friends, families, and neighbors. And one of the best things that you can do to combat COVID-19 is to get vaccinated. We know these vaccines work. We know they are safe. And we know that a majority of the people coming through our doors with COVID-19 are not vaccinated. I encourage you to be brave, trust the science, and help our community. I want to thank our staff for the sacrifices that they are making every day to care for our patients, our communities, and our neighbors. Let's all band together in this fight. Please get vaccinated today. Thank you.
My apologies to William. It's Georgetown Community Hospital, but the group, including Bourbon and Scott County, definitely doing a great job in getting their people vaccinated. But I know we still have a long way to go. He mentioned in there that their hospitalizations are primarily unvaccinated, and that's true. If you are unvaccinated right now, you are at the greatest risk that you have ever been in the course of this pandemic. I think Dr. Stack and I both want to be as upfront as we can that we are seeing more breakthrough cases every day. And remember, a lot of breakthrough cases may never be caught because you are asymptomatic. But what that means is that, again, more people who've been vaccinated are ending up in the hospital, but at a much smaller risk, much smaller risk than those that are vaccinated. But it shows that when we are indoors outside of our house right now, while this thing is burning as hot as it is, we need to be wearing masks. So let's look at the vaccination status of COVID-19 cases, hospitalizations, and deaths. What you'll see on here is still primarily unvaccinated individuals, but the cases are going the other way, right? There are times where cases were 90 or 91% unvaccinated or partially vaccinated. We're now at 86.8 according to this data. Again, we think that we know that the vaccines are highly effective at preventing serious illness and death, but we do need to acknowledge that with breakthrough cases, if you're vaccinated, you can potentially be spreading it to other people. And when you think about that, other unvaccinated people who may not be able to handle it, and we are losing some vaccinated people as well. Somebody I know right now on a ventilator, fully vaccinated. It is rare, but it is happening, and we need to protect ourselves. Now we're going to turn it over to Dr. Stack, who's going to go through a lot. He's going to give his thoughts on where we are in hospital capacity. He's going to talk about boosters and what we know today from the federal government may be different on boosters than what we learn in the next couple of days. So he's going to talk about the third booster for immunocompromised. We'll have to wait by any decision by the federal administration on anything different on boosters to address that. He's also going to go through 3 myths, because they are myths. They're in addition to the one that Lake Cumberland talked about, that you are not being injected with COVID-19. You can't get COVID-19 from the vaccines. But the 3 others that he's going to go through are, number 1, that this vaccine, we don't know enough about it, or it hasn't been tested enough. More than half all Americans have had the vaccine. So he'll go through that. Number 2, concerns that the vaccine might make you sterile. Entirely false. And number 3, concerns about complications related to pregnancy from the vaccine. He'll address all of those and his other points. Thank you, Steve.
Thank you, Governor. Good morning, everyone. It's still morning. Good afternoon. Jim, could you put up the ICU slide, please? Just one. I'm going to just use this one slide to talk about healthcare capacity. We have tried all along, I think, to be calm, be reassuring, to give people actionable information so that we can all get through this to better. And I think we both continue to want to do that. We've tried to be very candid and honest, though, too, so that you've had the information to make an informed decision. So I'm going to tell you right now, the healthcare capacity is going to get really difficult here in the weeks ahead. What's happening in the states to the south of us, they don't have any beds. And so our hospitals are starting to get calls asking to transfer ICU level care patients from other states like Alabama and Mississippi, I think, are the ones that I was told about. We're also getting reports from other states there are no beds available there. This is trickling over into our state. where we're now having the beginnings of critical access hospitals in your smaller rural communities and instances having to call numerous hospitals, bigger places in Kentucky, to try to find a staffed bed to send a patient to. And so this will cascade and it will get worse. Hospitals around the state are already beginning on a institution-specific basis to postpone or cancel surgeries or procedures that would require admission to the hospital after them. So things that are not emergent or urgent. Now, remember, that doesn't mean they're not important. Having a tumor removed from your colon is very important, but it doesn't have to happen tomorrow. So getting things delayed doesn't mean that important care isn't getting delayed. It is important care, but it's getting pushed off because there's not sufficient staff to provide those services and to have that person occupy a bed for a period of a day or multiple days after their surgery or procedure. So what this means is non-COVID patients are going to start being impacted. So a few things. First of all, if you go to an emergency department in Kentucky, you're going to have to be patient and you're going to have to be nice to the staff there because they're all under a lot of strain and a lot of stress. And a lot of them are particularly distressed that the hospitals that are now full and strained are strained because people haven't gotten vaccinated and haven't taken a simple step to protect themselves. And now they're going to occupy beds for numerous days that other people who have other non-COVID needs can't have access to. And so it places them in a very frustrating position where they feel other people are getting hurt because of the inaction of folks who have chosen not to get vaccinated. So please be patient with those folks. They're there to help you and they will treat you all with professionalism, but you've got to treat them with care and respect. This ICU slide, the reason I showed this, one, all three of them look bad, inpatient ICU and ventilator data. It is a vertical climb. There's no sign it is abating. We are already just shy of our all-time record. Another day or two, we'll be past that record for ICUs. What we're finding across the states is this disease, this version of COVID, the Delta variant, is hitting people harder. They are getting sicker and they are younger. And so what's happening is they're filling up ICUs in a higher proportion relative to the total number of people going into hospitals. And so this means that it will place a really serious strain on ICU capacity sooner even than the regular hospital beds. And we could find ourselves in trouble real fast where people don't have access to ICU level care when they need it. So folks, this is all preventable. None of this needed to happen. We've got to have people get vaccinated. Those who are spreading false and dangerous information are killing people. I don't know how to say it any more directly. People who are going out there and saying false and demonstrably inaccurate information about the utility and value of masks, about the safety and importance of vaccinations to prevent this disease are killing people. It's tragic. It's preventable. And folks, I would just encourage you to think real long and hard about where you get your quality medical information from to keep you safe, because now literally lives are depending on it more than ever before. If we could show, I'm going to do 3 vaccine slides here real quick. Jim, show the one the governor used, that table. I just want to talk the efficacy table. I just want to do one other little detail about this. So in the efficacy table, vaccine efficacy, yes, thanks. The governor accurately pointed out that the number of breakthrough cases or the proportion is increasing, and that we know that is happening. We're seeing that trend. What we're seeing for the hospitalizations or the deaths, where there's been not much, but just a little bit of erosion there, the people we're seeing who are those breakthrough ones who get sick in the hospital are the ones the CDC just approved a 3rd dose for. They're the ones whose immune systems may never have responded adequately to the initial doses. And we're going to address that. I'm going to talk about that very specifically. So what we continue to say is that these vaccines are incredibly effective in preventing or minimizing the risk of death and serious illness. And they still work fantastically for that. You can look on Facebook and find hospitals around the country who show little dot graphs and show what proportion of their people in the hospital, the ICU or ventilator, are vaccinated or unvaccinated. It is overwhelmingly unvaccinated persons, and they are skewing younger. And alarmingly, small numbers don't really make a big headline, but 17 pediatric patients in the hospital in Kentucky with COVID is an all-time high. It was 12 at its prior record in December. So 17 pediatric people in the hospital is a big deal because remember, even though some hospitals admit lower acuity children under 18, children or adolescents to the hospital, The only two facilities the Commonwealth of Kentucky has to take care of serious or critically injured or ill children and adolescents are Norton Children's and University of Kentucky. When those places are full and there's no room in the inn, there's nowhere else to send them. And the other hospitals are way less prepared to be able to take care for an extended period of time a sick child or adolescent. So we've got to have capacity at these facilities. And folks, with schools all going back, and for folks who think this is all not a big deal about wearing masks, you're wrong. You need to wear those masks because that's how we can prevent this disease from running like wildfire through all these communities. And if your children and you are eligible for vaccination, that's how we keep people safe. So we've got to do that. So let me talk now real quick on the third dose, and then I'll come to the myths, and then I'll be finished. So if you can put up the first to the third dose slides, please. So the CDC and the FDA last week changed the recommendations for folks who are immunocompromised. There's a list on the next slide in a minute when I show it that shows an illustrative list of who may be in this. In the Commonwealth of Kentucky, I have determined with our department that the Kentucky Department for Public Health will deem every resident of a long-term care facility to be eligible under this criteria. We had, for the vast majority of our journey in 2020 and early 2021, 2/3 of all of our deaths occurred in long-term care facilities, 2/3. And now it's gotten less than that now as the deaths have gone to other populations and the vaccinations have protected so many of these folks. But because of their medically frail condition often and the environment they live in a congregate setting, we are determining that all of these individuals in a nursing home are going to be eligible for vaccination for a third dose and will be offered a third dose, and that is already underway now and beginning. For everyone else in the general population, these are the individuals, people with these type of conditions who are identified as being eligible. This is not an exhaustive list. There will be others who may qualify. I encourage you to talk to your healthcare provider, talk to your physician or primary care provider, and ask them, do they think you are immunocompromised under this criteria? And if so, when you go and present yourself to get your third dose of either Moderna or Pfizer, you need only a test that you have a immunocompromised condition. No one's going to double check or verify. You need only a test to this and get this. Now, this is not a general purpose booster dose for all the rest of us. Currently, the evidence does not yet say it's necessary for those of us with intact immune systems to get a booster dose. Now, the media here in the room and others probably see the headlines just like I do. There's some talk about whether the Biden administration will go forward and change the recommendations as early as September about a third dose for a booster. We're not there yet. We'll update you as soon as we have firm information on that. But for right now, all of these individuals, if you fit in these criteria, I encourage you to go to a local pharmacy. If your primary care doctor is doing vaccinations, your hospital, your health department, and get your third dose, because you may not have had an adequate response to the first two doses, whereas those of us who have intact immune systems are probably still in pretty good shape. The final point I'm going to mention, you can take down those slides, Jim, is about these myths. I don't want to be sensational, but I want to be explicitly clear. Those who are passing along lies, they are lies about these vaccines, are killing people. It is horrible. It is tragic. And I urge you all to be very careful about where you get your guidance on this. These vaccines, across a whole variety of them, have been administered the world around. We've given out, according to the World Health Organization's website, almost 4.5 billion, that's billion with a B, doses of vaccine to human beings around the whole world. It's probably about 1.7 billion with a B human beings have had at least one dose of a vaccine in the world. Nearly 200 million Americans have had at least one dose of some vaccine. And in Kentucky, it is more than 2.4 million Kentuckians have had at least one dose of vaccine. These pharmaceuticals are the most heavily studied, heavily scrutinized, heavily monitored, and rapidly deployed pharmaceuticals that humanity has ever seen in all of our existence. And they've been deployed for over a year now when you go back to the first people who have enrolled in the initial studies. These are not experimental. These have been rigorously studied, actively monitored, and overwhelmingly been found to be safe. And in addition to that, the risks of getting COVID are so much larger than any risk you take with the vaccine. So I urge you to not fall into the trap of believing there's this myth that these are not studied robustly. They are studied more than probably any other vaccine in a short period of time has ever been done. As far as pregnancy and fertility, there is no evidence whatsoever in this 4.5 billion people of all of humanity who have received doses of vaccine that there is any adverse impact on pregnancy. In fact, what there's a lot of evidence about is if you are pregnant and you get COVID, your risk of serious harm or even death to yourself or your unborn child is much higher with COVID than if you were not pregnant. Please, if you are pregnant, get vaccinated. The CDC recommends it. The American College of Obstetricians and Gynecologists recommend it. The Kentucky Department for Public Health recommends it. And finally, there is not a single signal or warning of any sort that these vaccines have any adverse impact on your fertility. There is not a single warning sign to that effect. That is a falsehood. And because it has caused some women to be fearful about getting the vaccine, those who are propagating that falsehood are hurting people. And it is horrible that that is being done. So please, there is no truth to any adverse impact on pregnancy or fertility. I urge all women to please get vaccinated, pregnant or not. And the mRNA vaccines are particularly wonderful, and that's the technology that will continue to evolve. So any of the 3 vaccines are good, but the Pfizer and the Moderna, now that we have so much evidence, are particularly good, and those are the ones I think many of us who study this would probably prefer to get. Thank you very much, Governor.
All right, so a lot of information today. We'll open it up to questions. We have people here. We have folks that are on the line. We'll try to get through everybody. We'll start with Victor.
At the start of the pandemic, there were field hospitals.
There we go.
That were put in place. Has there been any consideration to putting those back in place?
I'm sorry, ask the restrictions?
No, the field hospitals.
Oh, the field hospitals. Right now, we believe that there are 2 reasons why we're not looking at field hospitals. Number one is that each of our hospital systems out there have a surge plan. That's why when you saw St. Clair saying that their COVID unit was full, they were switching an OR room to a new COVID unit. So they've all worked through plans now on how they can surge up. But here's the more sobering issue. We don't have enough healthcare providers to necessarily support a field hospital because it's not the number of beds that are limiting, it's who staffs them. It's having enough nurses and doctors right now working all of their shifts. We run out of capacity of someone to see you before we run out of the bed itself. And that's why we're working to try to have a more accurate estimate of any time. If we say ICU beds, if you don't have enough staff, the extra bed doesn't matter. So we're trying to get a staffed bed number as we move forward. So we still have just about everything physically we need to set up the field hospital. It is stored at our Department of Public Health warehouse. We could get it up in a short period of time, but we'd have to make sure we can staff it. What we are looking into is how we can try to provide and amplify staffing for areas that need it badly. When they've run out of staffed beds, what can we do? Even if that's coming in and taking over some of the food service and other help, what can we do to help increase people's capacity? Austin?
Yeah, specifically looking at schools, and do you see them needing to report to really address potential problems down the road, report cases of quarantine?
So every school system is reporting cases and quarantines to their local health department, and the vast majority have a page up on their website or others. Every school system needs to be very transparent with parents and in their communication, and we feel that as parents. We are still considering whether or not we need to revive that state website that tracks. Again, while we know that I had concerns about decisions that were made on universal masking, I do believe that school systems have responded admirably in their disclosure and how they address an outbreak once it occurs. And so we learn where some of the holes are as we go. But we're still considering whether or not that will be needed. I want to make sure that it's not that the importance of the reporting and the transparency outweighs the extra burden that might be there. Karen?
Thank you, Governor. And/or Dr. Stack. Are underlying health still playing a major factor, or at this point is this variant so aggressive that that's not as much of an issue anymore?
Question is on underlying health conditions and your exposure to this Delta variant.
So yes, underlying health conditions still do play a very serious role in your risk with COVID. And so we find that both in unvaccinated, where your risk is much higher with Delta than it was before. And that is a skews to younger population. We see that because this is more aggressive, but we also see it in those who have breakthrough infections, who are the ones who go into an ICU or get really sick. They tend to be people with numerous medical problems and reasons why their immune system probably is compromised from their chronic illnesses, and they haven't mounted an adequate response. So yes, comorbidities still play a large role.
And Dr. Stack and I have talked a number of times that as the information evolves, because we still don't have enough, that we think it's likely that we'll find that there is a correlation between breakthrough cases. And remember, how the federal government tracks that is hospitalizations. They're not just tracking positives and folks that may have been more vulnerable early on as well. Tom.
Well, thank you, Governor. Shortly before I came down here, my daughter sent a bunch of photos of her parked in line at the Kroger Fieldhouse testing area. Huge line of cars out there. And that kind of brought to mind, I heard on a news report this morning that there is a potential shortage on testing kits. Is that indeed the case, or is that isolated, not here in Kentucky?
So question is on testing. It is good that more people are looking to get tested now. We have some concerns that the rules or reimbursement with testing have changed as the original and the alpha variant were declining. Where we got is private insurers would not pay for a test unless you met certain criteria. That's very different than before. Anybody who wants a test or is concerned or has maybe been exposed to someone could get it. With that change, we have seen fewer people getting tested. More and more of the people that are getting tested are already sick. We are working to remove that barriers in our Medicaid population and working with insurers to try to get back to a practice where anybody who wants the test can get it. I think that there is ample testing capacity out there. Of course, any time that there is all of a sudden a big bump in something, it may take a little bit to catch up, but I'm not worried at this point about overall testing capabilities or shortages in the country or here. Bobby McSwine.
Be able to hear me?
I can hear you.
I'm wondering, I know we talked about long haulers early on in the pandemic. I've seen it reemerge. Is that something you all are looking into?
We continue to be concerned about long haulers, and it brings up a really important point. We talk about death due to COVID, and rightfully so. I mean, that is the worst outcome. But what I don't think we as a population have enough appreciation for is COVID can not only get you really sick in the short term, but a whole lot of people have stayed sick in different ways for months or even longer. We've seen some people even take their lives based on the complications, impacts on them. There's still so much we don't know about the long-term effects of the virus. Some people are worried about the vaccine. We still don't know so much about the long-term impacts of the virus, but we know that they've been really significant and really difficult. And right now, we can't say for sure why someone has long hauler symptoms and conditions and another one doesn't. And that ought to raise even more concerns with what we want to do to make sure that we prevent getting the virus in the first place. But it's a really important point. that COVID doesn't just kill you, it can make you really sick for a long time. Shaq Lord.
With capacity levels for hospitals near critical, and with the data for the positivity rate increasing, the cases increasing, do you anticipate issuing any mandates in the future, or are you kind of playing it by ear?
So everything we're seeing is alarming. And that means if we have to, we'll take additional steps. At this time, those steps certainly would not include any form of shutdown, because vaccines plus masks, we can be fine. It does not currently include any type of capacity restrictions, but we're going to have to very carefully consider and continue to evaluate whether or not we need to bring back a statewide mask mandate. That's where we are. That at least has to be a part of the conversation, because if we run out of beds for people, if we run out of beds for people who are injured or sick or have a heart attack, don't we have to do something? Don't we have to do something to make sure we've got that capacity for everybody? And so it's under active consideration, and we continue to watch the numbers, those hospitalization, those ICU numbers being the most concerning. All right, on the line we have Debbie Yetter from the Courier-Journal.
Hi, Governor. Kentucky's got, I think, about 100 care hospitals in the state. How serious is the situation with these hospitals? How many are, if you know, are reaching capacity or likely to be at capacity in the next week or so if this trend continues?
So we're working again on getting a solid metric. Some other states have metrics out there. We don't know how accurate they are versus beds versus staffed beds. And so we're working right now to get there. But I think that the reports directly from these facilities are very concerning. I think that everybody is at a higher level than they ever expected. I think just about every hospital, well, certainly what we have seen is a lot of our rural hospitals are higher than they've ever been already. And we continue to see hospitals full and reporting that they are full and or are full from a staffing standpoint. And that goes from east to west. We see our hospitals already taking steps that are significant. When a hospital starts canceling elective procedures, and almost all of them are, now that hits their bottom line pretty hard. It means that they know that there is a very substantial danger out there. Corinne Boyer from WEKU.
Hi, Governor. With the number of cases and hospital ICU capacity expected to surpass previous highs, why not reinstate the mask mandate now before things get even worse?
Well, it's under active consideration. The difference now versus before, actually, I think there are a couple of differences. Vaccines are the number one difference. And again, before, when we had the mask mandate, we didn't have the option to go get vaccinated, for everybody to do their part and to be done with this. I think one of the frustrating parts or one of the tough parts to process is that we could win this war tomorrow. If everybody who's unvaccinated who qualifies would go out and get the vaccine tomorrow, we could vaccinate 500,000 people tomorrow. We have that many vaccines that are out there and ready. Then we wouldn't have this surge. We would have open beds for people who needed them for COVID or not. Second piece is we are seeing more support and or active steps being taken by both public and private entities. So many businesses now are going back to masks for everyone. Distilleries, manufacturers, and others. We're seeing more and more private sector decisions here. And when that happens, you get a lot more buy-in as well. It's just a lot of different points of leadership and leadership points that are closer to people. We saw our universities all go back, and I think virtually all of our private universities that I've seen have announced that they're going to require masks. So those are the two things right now, the level of private and public sector activity, of local leadership that we're seeing, which is important and powerful, as well as the vaccines themselves. But again, it's under active consideration. It has to be with everything we're seeing. Alex Akisto from the Herald Leader.
Hi, Governor. You mentioned that the issue going forward will be bed capacity, but more so staffing of those beds. In the same way that we're being asked right now by other states that are experiencing surges farther along than ours to borrow our hospital resources, has your office in any way begun preemptive talks with other states that aren't experiencing a surge as bad as ours about either borrowing hospital resources or in some way securing more staff?
That's a good question. We have not, as an administration, talked to other states and systems. Now, the actual hospital systems themselves do that and do it actively. What we are working on at the moment is how, whether it's through the National Guard or through other possibilities, how do we provide more medical and other staff to these systems as they become overwhelmed? Are we able to put together additional strike teams as we have in the past? And we're digging pretty deep on that. One of our challenges is if you look at our National Guard and folks that have a healthcare background, they're already working in one of these systems and at one of these hospitals. We are going to start conversations with the federal government, though, preemptively. I think we're having one today about their ability to come in and help and provide extra help, whether that's through FEMA or other means. We are going to hit the point where we need more help, but we found typically when Kentucky hits that point, it is rapidly spreading to our north and has already overwhelmed the south of us. So yes, we're going to look everywhere we can for help, but every point in this pandemic, we've had to look out for ourselves, and we got to be prepared to do that. Again, get vaccinated, and you're looking out for everybody around you. Joe Ragusa, Spectrum News.
Hi, Governor. So a couple of questions here, both of them political. I don't know if you've gotten the chance to see any of the committee hearing that's going on right now discussing the administrative regulations regarding the mask mandate. I wanted to get your thoughts on that discussion. And also on a bill that has been pre-filed to prohibit government entities from putting in a mask mandate at schools, public universities, child care centers. I guess just what are your thoughts in general about the political discussion that's going on right now?
Well, this is what happens when politics runs over public health or common sense. I haven't watched the committee hearing, but folks, every single public health entity in the United States, every entity that impacts Kentucky, from the CDC to our Department of Public Health to every single local health department in Kentucky, says universal masking in schools is a must to protect our kids and if they're going to be in person in class. The Kentucky Chamber of Commerce says universal masking in schools is a must for them to have their workforce. The educational associations that the people who actually work in the building belong to say it's a must to protect them. That's everybody. And for folks to push back on the private sector community, the healthcare community, with nothing other than politics is wrong. And oh my goodness, look at what's happening in Arkansas right now. I mean, a bill that prevents entities from instituting a mask mandate when there is such a surge and a deadly variant out there, that kills people. Some have lost how we have always viewed our liberties as Americans. We have always believed, and it's always been the law, that you have a freedom of speech, but you can't run into a crowded movie theater and yell fire. Your individual liberty ends when it harms other people. Your individual liberty to swing your fist ends when it impacts somebody else's face. That's called assault. And an individual liberty does not exist to actively spread a deadly virus that can harm and kill other people when we know some very small and basic things to stop it. I think about it in terms of sacrifice that people have done for this country. My grandfather going overseas to fight in World War II to save people, and we're asking people out there to put some cloth over their face to protect their fellow human being. I think about it in terms of my faith, where my Savior was crucified to serve all of us. And we're asking people to simply put a piece of cloth over their face to serve their neighbors. We know what the right thing is. We just got to be strong enough to continue to do the right thing. Melissa Patrick, Kentucky Health News.
Hi, Governor. My question may be for Dr. Stack, and it goes back to the committee meeting. There was a physician that said masks don't work, and another one that's speaker basically said, if masks work, why have they not worked? And so I guess I would like to just have some discussion about, why do masks work? How do they work? Why do they work? Why is this true or not true?
I'm gonna turn it over to Dr. Stack, but it's really important, I believe, in our reporting to have the facts out there, and that is that masks work. American Academy of Pediatrics says masks work and we ought to wear them. The CDC says masks work and we need to wear them. The Lake Cumberland doctors are pleading with their community to wear masks, saying masks work and we need to wear them. But we have two different case studies, both of which have already proven it. Number one, it worked when we brought students back in the last school year. We've already seen it. And number two, compare a school that started with universal masking, and yeah, there are going to be some quarantines, but they are relatively small, versus ones that haven't, which are hundreds upon hundreds, some going over 1,000. I mean, it's right there in front of us. It's happened in some of the districts of the people that even challenge it. So we got to separate those that are going to challenge direct truth and facts simply because they wish the reality was different. Dr. Stack.
Thank you. I think I'm grateful for the opportunity to address this, but in my directness, I wonder at times that masks work. There's countless different types of evidence that they work. Last year in the school year, we functionally eliminated influenza across the United States of America. That we had almost no confirmed influenza cases, and the deaths plummeted. And we have that data, and I can pull that up for Thursday, how our influenza data plummeted last year. There was virtually no RSV, virtually no common colds. All right. My kid went back to school, and now kids are coming home with colds. RSV is surging across the United States in kids in August. It doesn't do that normally. It does it in the fall and in the winter. It's starting earlier. We shut all of that down because, yes, masks work. The reason they may not work quite as well for COVID is because COVID is even more transmissible. It's more contagious than some of those other infections. But do they work for COVID? Yes, they do. And the CDC and its morbidity, mortality weekly reports and many others have published real-world scenarios and analysis and examples where people wore masks and people didn't wear masks in similar settings, and showed that where masks were worn, it reduced transmission and spread of the disease. What I want to urge folks is what we want to believe and what is real are not the same things. And because people who are, this is not just about politicians, this is just people in general, are in positions of responsibility in peddling lies and falsehoods that we want to believe that aren't true, there are going to be people across the country who die, who have nothing to do with COVID, because all the COVID people they don't believe in are in the hospital filling up all the beds. So folks, there's no, these false equivalencies, folks have got to call that out. Don't be rude. Don't be mean. You still got to be patient and tolerant with folks. Don't be disrespectful. But don't let these false equivalencies and just outright lies be put on par with things that science has shown. And as we learn more, science continues to iteratively improve what we understand and know. So we share with you when our understanding evolves. That's not the same thing as none of these things have value. It's because we have the ability to learn and improve over time as we have experience. So the masks do work and the vaccines do work. And what you see happening in some of our southern states, and I hope doesn't happen in Kentucky, is the insanity of preventing all the things that could prevent the crisis, and then turning around and offering these half-good solutions to try to treat people who are getting hurt and are dying because they blocked all the efforts that could have prevented it at minimal or no inconvenience to the rest of us. So folks, please use science and use the intellect we were gifted with to make good choices so that we all don't get hurt by this. Thank you.
And I just close on that question with everybody who's working in a COVID wing wears a mask. There's a reason. They're in healthcare. They know it works. They've been wearing masks for a long time. And second, I don't know if everybody remembers this, but back last year, I was in a car with someone who turned out later to be positive. We were both wearing masks, and I never tested positive in the end because masks work. Ellen Smith.
Hello, Governor. I just have a question. With the CDC's recommendation for booster shots, what is our supply looking like for Kentuckians?
We have a robust supply. We wish more people were coming in and getting their first or even their second shot. I think we have somewhere close to 500,000 doses that are out there right now that could go in somebody's arm, and we can order a whole lot more. Supply is no longer the problem. Now, if they open up boosters to everyone eventually, then we're going to need to set up some bigger operations to get folks through. But we believe that if they go there, it's going to be a certain amount of time that they're going to recommend after your second one. So I think people are going to be able to be scheduled in whatever their local provider is. And remember, it's everywhere now. You can beat this pandemic by going to the drugstore, the grocery store, your local health department, just about anywhere. All right, last question. Sarah, I think it's Lou from WCHS. All right, we'll follow up to get that. Again, everybody, be safe, take care of one another, realize that we're in a tough place when your local hospital is filling up. Do what it takes to protect one another. Most importantly, get the vaccine. And just know that the vast majority of people out there are doing it right, are willing to do what it takes. We're going to get through this. We're going to get through it together. Thank you.